This is Case of the Week number 10. My name is Dr. Johnson and I'm a gynaecologist from Southampton. The patient was 30 years old and had been trying for a baby for the past year. Her periods were regular and she had some mid-cycle pelvic pain and no operations. These are the ultrasound images from the examination. This is a longitudinal view of the uterus, with the fundus here, the cervix there, bladder would be here. And this is a transverse view of the uterus. The patient's right is here and the patient's left is here. This is a video taken at the same time. It's a transverse view of the uterus, scanning from cervix to fundus. What's the diagnosis? Is it a normal uterus, endometrial cancer, adenomyosis, endometrial adhesions, or a unicornuate uterus? Here again are the original ultrasound images. So this is an anteverted uterus, anterior wall, fundus, posterior cervix, cervical canal into the endometrial cavity, and the measurements of this uterus are normal. Then this is a transverse view up at the myometrial fundus. And you notice that the endometrial cavity is circular and that the uterus is 4 centimeters in width, which is slightly narrow. Here's the video again, starting at cervix with cervical canal, going up into the endometrial cavity, into the interstitial portion of the fallopian tube, just there. On 3D, this is what the uterus looked like. You can see that there's a single portion of fallopian tube. This is the interstitial portion of the fallopian tube. The endometrial cavity is narrow. This is what a normal uterus looks like, with a nice triangular endometrial cavity with 2 fallopian tubes. These are the interstitial portions again. Looks quite different. This was a unicornuate uterus. The key features are to scan slowly in the transverse view of the uterus from cervix up to fundus. The cavity will be narrow with a circular central endometrium, which does not become wide at the endometrial fundus. You then see a single interstitial portion of the fallopian tube. You can make the diagnosis on 2D, but it's easily missed. But the diagnosis on 3D is very easy. It's best to image such a uterus in the luteal phase because you get a nice endomyometrial contrast. Look for a nearby rudimentary horn. And remember to scan the kidneys. Congenital uterine anomalies are associated with renal anomalies. With respect to this patient's subfertility, it's time to start some investigations, but the abnormal shape is probably incidental. She should, however, be referred to gynaecology to discuss the shape and the increased risk of adverse pregnancy outcome. Her cyclical pain was most likely ovulation pain. Thank you.